Good afternoon, everyone. We're just going to wait for everyone to join the webinar. Just give us a second. All right, so good afternoon, and thank you for joining me this afternoon for our bi-weekly town hall meeting. Good to quote unquote see everyone. I want to talk a little bit about our COVID numbers, but before I do that, let me just open with a few thoughts. We've spent a very long time navigating the pandemic, over a year, and we're seeing evidence. Obviously, we're all watching the news and other sources that tell us that the end possibly is near, and more demographic groups are becoming eligible for the vaccine, and more members of our community are being vaccinated. I'll share that the New Hampshire College presidents recently met with state epidemiologist Dr. Benjamin Chan to lobby for colleges and universities to begin vaccinating our own populations. And while it's doubtful that we're going to get approval for that soon, what is clear is that recently President Biden said that all US residents will be eligible to sign up for a vaccine by May 1st. And in New Hampshire and Massachusetts, all residents 16 and older hopefully will be eligible to sign up in just a few short weeks. We are very close, so close. And at the same time, we're at a very delicate moment when it comes to managing the pandemic response, both as a community and as individuals. And, you know, when you're in a sprint and you look behind you and there is a large boulder coming at you, and you look ahead and you see daylight and safety, it is not the time to slow down. And so in this context, we have to make some decisions, and this is what I'm sharing with you today. The COVID analytics team, the senior leadership team, and I have all agreed that it is in the best interest of the health and safety of our community, we're going to pause on-ground instruction and move to remote instruction beginning this Friday and through Easter until Wednesday, April the 7th. So we're going to go remote beginning this Friday, March 26th, through Wednesday, April 7th. We will be asking students to depart campus by the end of day tomorrow, Thursday. Some students will need to remain either for academic or health reasons or because they live too far to get home at this point in the semester. And we are going to be prepared to accommodate those students and to make exceptions. However, most students will be heading home so that we can reset our bubble and come back from Easter with a renewed focus on what we need to do in order to complete the semester and to keep our caseload at a manageable number. So let's give you some very specifics about our COVID situation. So this week, as of the end of day yesterday, we had 17 student positives, which continues to the trend that we saw last week. And I can tell you, as of right now, today, we have 11 more positives this morning. As you know, the college's COVID-19 positivity rate has been consistently above 1% since the week of February the 15th. This level of cases has posed challenges, but as I shared in my community update on Friday, our health services, residential life, campus security, and athletics teams have done an incredible job managing each week's new positives. I can't say enough about what this core group has done and how they have really worked hard to keep our community safe. Thanks to their work and to the work of so many others, we have developed really a new tolerance for positive COVID cases. Last semester, a handful of cases in a given week would have been troublesome. This semester, as we witness the success of our surveillance testing program and our ability to contain the spread and safely house students in isolation and quarantine, our comfort level of what could be managed has increased. Last week, however, we saw a concerning uptick in COVID cases, which puts significant strain on our housing capacity. So here are some factors that led to this decision. Our cases are high. As I said, we have 59 active cases as of today, which includes 6 from yesterday's testing. And again, as I said, we've already had 11 positives this morning. So obviously we have high cases. The student positivity rate for the past 10 days is 3%. It has been steadily over 1% for a month, which we consider problematic, but in the moderate range, but it has now spiked to the high range. And I'll say this does not even include off-campus positives. There were 5 positives through off-campus testing this weekend. We are struggling with containment. Some recently new cases have resulted from students who are already in quarantine, but we are also discovering an increasing number of new originating sources too frequently. Combined with the troublesome number of students testing off campus rather than through our own testing protocol, which makes it more difficult for us to track, it is clear that we're having trouble getting our arms around containment at this moment. And finally, we are at housing capacity. We have 32 students in isolation on campus, and at this point, we are beginning to cannibalize quarantine space to use for isolation. Spaces for female students are particularly strained. Earlier this semester, we had waves of positive, usually high at the beginning of the week and low at the end of the week. This allowed us sort of to catch our breath with isolation, contact tracing, and management of students in isolation and in quarantine. Over the past month, the cases have remained consistently high all week, which has meant beds are filled as soon as they are available. The rooms are not being properly disinfected between isolation stays, and our staff delivering food, supplies, and doing medical checks are reaching the limits of students that can be properly cared for. I will also say student conduct has deteriorated to an unsustainable level. The numbers and levels of infractions and rude behaviors have made it clear the incentive of the phase system and the implementation of discipline is having little to no impact. So for these reasons, we believe the best course is to, as it were, do a hard reset by sending students home and conducting post-Easter testing similar to the levels of move-in testing in order to reestablish the bubble. Also, it will provide a much-needed mental health break for our students, for our staffs and faculty who have worked so hard this semester and have struggled so long to manage the pandemic. After Easter, we must redouble our efforts to enforce the Community Care Covenant, and when we return, we will do exactly that. We all yearn for normalcy, but we simply are not there yet. The CAT, the COVID analytic team, and the senior leadership team will continue to monitor the data, and we will stay focused on our number one objective, which is the health and the safety of the community. We will need to accomplish this goal. We need to be in this together. We're almost there, but we just need to hang on a bit longer. So I'm going to stop there. This is pretty much the entirety of the town hall today to really focus on this. It's been a really difficult decision, but we believe it's the right decision given all of the data that we're looking at. In effect, it moves 4 days of classes to remote format this Friday, and then Monday, Tuesday, Wednesday of next week. The week after Easter, we were already prepared to have Monday, Tuesday, and Wednesday in remote format as we tested. And so it's not a terrible change at that point, but we feel like we need to take this pause to reset our campus and to make sure that we can and are in the best position possible to finish the semester successfully. So again, let me just stop there and I'll take some questions. So let's see. Is there student representation on the dining in-house vendor decision committee? Okay. There is definitely going to be student representation as well as staff and faculty representation on that committee. At this point, we're beginning to put some information together, but there will be some representation on there. And a shout out to Dining Services, incredible work. They're there every day. They continue to do extraordinary work, great food for students. I was down there yesterday walking around, and it's just extraordinary the work they do. Our staff going to be asked to work this evening and tomorrow evening, just as we did last March. If you're interested in working this evening and tomorrow evening as we help students move out, we would certainly appreciate the help. I know that our student affairs staff would certainly appreciate the help. If you are interested, I would ask that you be in touch with the Dean of Students office and let them know that you're interested. I think they would be very, very grateful for any and all help they can receive. Will we continue to test this week just to maintain data on infection rate numbers before reset? Yes, we're continuing to test this week, even as students are moving out. And as you know, from our HR group, we're testing employees as well, staff and faculty. Why is it you think students are testing off campus? When you mentioned this phenomenon earlier, it seemed that you were implying it was a problem or a concerning trend. It's a great question. I think the challenge is that if a student tests off campus, it's on them to disclose to us what the result of that test is. We don't know that they're testing off campus. And so it's difficult then to respond if that comes back positive. So I think just in terms of contact tracing, it poses some challenges. So we've been strongly encouraged students, faculty, and staff to test within our protocols, unless there's really good reason to be tested outside of that, which may be that you're feeling ill or you have no other option. So that's the challenge, that the contact tracing that follows from that is a bit more challenging. Given students are asked to leave Thursday, does that mean all classes are canceled Thursday? No, classes are on Thursday. There are no canceled classes. I want to be clear about that. On-ground classes will be held through Thursday, and then starting on Friday, classes will be held remotely on Friday, Monday, Tuesday, and Wednesday. There are no classes on Thursday, Holy Thursday, April 1st, or Good Friday, April 2nd. But then remote classes will resume on Monday, April the 5th, Tuesday, April the 6th, and Wednesday, April the 7th. And then on-ground will begin again on Thursday, April 8th. Just be clear about that. Thank you for making this difficult decision in the best interest of our Anselmian community. Well, it takes a village, and so I've really appreciated the great work of the COVID analytics team. They've really looked hard at the data. I appreciated the work and support of the SALT team, and just appreciate so much the work of the offices I've already mentioned, health services, residence life, campus safety and security, our athletics, just extraordinary work that they've been doing. Are there any implications for the schedule for pre-registration and registration for fall classes? No, there's no implications for that. If there is an issue, or if you think that there might be an issue, please be in touch with either the registrar's office or the dean of the college's office to discuss that. What will be done regarding this past weekend in terms of students on campus partying? That was very disappointing to see, and students thinking that it is acceptable. What will be done about that? Well, first of all, there were students that were written up last weekend. We've had a couple of students sent home. So I want to be clear that enforcement is happening, though it's not always public when that happens. But I know that our student affairs staff have discussed being much clearer with students when they return about the expectations with regard to activity on campus. We're just going to have to be very clear and very crisp about the consequences of not following the community care covenant. And we are going to be very serious about that coming back, because otherwise we will be in this same situation come the end of April. And of course, that's the last thing anyone wants. So we want to be clear about the expectations for student behavior. Is the college doing anything about setting up vaccinations for faculty? Well, again, that's one of the things I raised with Dr. Chan last Friday. I said, look, K-12 faculty are getting vaccinated. Why wouldn't the governor consider college professors in that group? And he just simply said, that's not the phase they're in. I got the sense that the governor was not considering changing that. Even though we certainly raised it and advocated for that change. So again, I just encourage everyone to get their vaccine whenever they're eligible to. It's a hopeful sign that now 50 and over can sign up in New Hampshire. And so please, we strongly encourage everyone to get the vaccine when they can. Is college, let's see, does this mean that the admission office will discontinue tours in the meantime? It's a great question. We have tours scheduled on Monday and Wednesday of next week. So at this point, we will continue with those tours. Again, it's really important for our enrollment efforts that students, admitted students, come to campus, see the campus. It's one thing that really helps us in our yield. So we're going to continue with that. It might be easier actually with most students off campus, but that's the plan at this point. Will students be questioned upon return to determine if they participated in spring break activities? Or another way of saying it, the students partied in Fort Lauderdale over an extended break, should they be allowed back on campus after Easter? There is going to be some conversation with students, and part of the communication out in terms of the move back after Easter will include some of that information. So the move back is going to look very similar to the move in. Students will be assigned times, and everyone will be tested when they arrive, and then everyone will be tested again within a certain amount of period to make sure that the incubation phase, we've gotten through that. So, but it's a good question. And again, like I said, I know that we want to be really clear with students about the expectations for behavior. If students are pursuing off-campus internships, are they included as students who are able to remain on campus? Thank you for this update and for continuing to keep St. A's community informed. If there is a specific situation for an internship, we will have an exemption form that needs to be completed and submitted to the Student Affairs Office. So make sure that you're in touch with that student, if you know that student, or in touch, if you're a faculty member, to be in touch with the Dean's office to explain that, because they could help run a little interference on that. But we're trying to be as flexible as we can be in terms of student experience, so internships, clinicals, student teaching, those kind of things. But obviously, part of this plan is to get as many students off campus as possible. Will there be a mental health break for staff members? Well, for sure, Friday, Good Friday is a even though officially the college is open that day, I would hope that that faculty and staff can take some time over Easter with their families. I know it's been a very long semester, but we're continuing to have some conversations with HR about some other possibilities for faculty and staff. When will the fall 2021 academic schedule be posted? This is important for planning purposes. As far as I know, the schedule, well, I would just say be in touch with the dean of the college's office. I know there are some pieces of that schedule that are completed. Maybe there are certain dates that you might need in terms of planning, but I know given the state of things at this point, we're trying to keep as much flexibility built in as we can. Are people that are in isolation right now expected to continue in isolation, or they be allowed to go home? So we've always said to anyone going into isolation, if they would prefer to do the isolation at home, they would be allowed to do so if they could travel there safely. So if they have that option, they can certainly isolate at home. If they don't have that option, then they will be staying on campus. So that's the way that we'll work that. Are you recommending that offices which support students remain open, or should staff also be working remotely while closing the offices to discourage in-person student engagement? Thank you. That's a great question. We encourage staff that can work remote to work remote for safety reasons. If you can do your work, even interacting with students virtually, that would probably be a better thing. So I would encourage exploring ways to do that rather than in person at this point. If students are off campus but still want to use the services, say in the Academic Resource Center or in Career Development or the Melia Center, I hope that they'll still be able to do that, albeit remotely. Would the college consider increased testing of students when they return in April? Yes. Well, we plan, we're going to definitely have a robust plan for testing. Like I said, students that have not been vaccinated, students that have not had COVID in the last 90 days, all other students will be tested and then tested again when they return in April. In Mark Cronin's email and some of the exceptions he mentioned, nursing students may remain on campus. Can you confirm this? Who will be notifying this cohort of students? So I know that the dean has been in touch with our nursing department. It's really important for our nurses to get their clinical and preceptorship hours in. Also, many of our nursing students have received the vaccine because of their work. So yeah, we're trying to arrange to make sure that they can stay on campus to finish their clinicals and allow them to complete the semester successfully. In terms of communication, I'm not sure, to be honest. It'll either be the nursing department itself, I suspect that'll be the case, or the dean's office. When will the students be permitted to move back on campus? So the move back plan is still being developed. I think at this point, some will begin to move back Wednesday, April 7th, and continue to move back the rest of the week. So that's but I can tell you that there's some still planning going on around that, and that will be communicated out to students probably next week. What variants are students positive for? We do not do variant. Part of our testing protocols, we're not doing testing for specific variants. So I can't tell you that question. I can't answer that question for you. We do know that there are variants in New Hampshire, but as to whether or not our students who test positive have one of the variants, we don't know that. Once we are vaccinated, do we still have to send Molly McKean in the HR department, the COVID protocol each time we are on campus? No, in fact, you're going to receive an email from HR this afternoon that's going to update what is expected of employees. One thing that we hope you will consider doing is that there is a way to put in your vaccination information into Paycom. I did mine last week. It's very easy to do. And so that way we'll know kind of a general sense how many employees on campus have received the vaccination and when. So look for that HR email this afternoon. Perhaps students should be tested every week instead of randomly for the rest of the semester. And we've had a lot of conversation about this at SALT. I can tell you that we've done a very deep dive into our testing information and pulling out students that have been vaccinated, pulling out students who have had COVID, pulling out students who are remote this semester, entirely remote. It seems like we're testing pretty robustly the remaining students in in the population. So if you're interested in that, I would ask that you be in touch with me. I can, I'm happy to share what we have in terms of our testing. But I can tell you that certainly you can look at it positively or negatively. Given the numbers of positives that we're discovering, it seems clear that our testing protocol is working the way that we wanted it to work. In fact, it's working perhaps too well, but in a good sense, because we're clearly finding positives and responding very quickly to them. Should staff faculty continue to work on campus during the remote instruction period? Again, faculty, they will be teaching remotely. So wherever they can do that, they should do that. If that's at home or they feel like they have to come in to do it in their office, that's okay too. Staff, again, just continue to follow the protocols that your office put in place in terms of coming in. I know some offices have different staff working remotely. I would say if there's any question about that, to be in touch with your supervisor. For academic year 21-22, the academic year 21-22 is on the registrar website already. So the academic calendar is there. That's what I thought. You can find that on the registrar calendar. And classes begin with a modified schedule on Monday, August 23rd. So there you go. Why is staff no symptoms who come into contact with COVID on campus being refused on-campus testing? They have been instructed to seek testing off campus even though they do not have symptoms. I don't know how to answer that question. I think it has certainly been our practice that if you want to be tested, you contact HR and they get you tested. So if you have a question about that, be in touch with Molly McCain and HR. And if you'd like to be tested, we can make sure you're on the list. Should we expect the cancellation of in-person events booked by campus and student organization as of Thursday, and by what time? That's a great question. I don't know what time. There'll be some communication sent out from the Student Affairs Office or whatever office is sponsoring those events to let you know about the status of those events. If the nursing students remain on campus, can faculty continue to teach in person in their classrooms as originally planned? Again, that's a question that needs to be resolved between the nursing department and the dean's office. Again, all of our nursing faculty have been vaccinated, our nursing students have been vaccinated. So I don't know the answer to that, but that is something to be in touch with the dean's office about. I had to step away. Can you repeat what you said about the vaccine at the beginning? All I said is at the very beginning is that both the governor of New Hampshire and the governor of Massachusetts have said that it'll be a few weeks when be able to sign up for the vaccine will be open to anyone over 16. So again, we just encourage people to get the vaccine when they can sign up for it. We don't have a plan right now to be a point of distribution for the vaccine on campus, even though the state has asked us to be, but we don't know at what point that will happen. Obviously, I made the case that, the positivity rate among 18 to 25-year-olds is growing, and we hope the state would consider vaccinating college students sooner rather than later. But again, I'm doubtful whether that will occur. And so we just need to get the vaccine whenever it is open to us to sign up for, and so that we can get that. So I encourage everyone to do that. Is there a residential uppers versus lowers issue with COVID cases on campus? In essence, are the upperclassmen contacting COVID at a higher rate than sophomores, juniors connected to their housing? It's a good question. I don't know. I haven't looked at the data according to class year, so I think that would be something that our health services folks and our athletic folks would have to answer that. Because people who have had close contacts are required not to come to campus. Oh, I see. So the question about not being able to test on campus, if you've had close contact, it's because you've had close contact, so you should be in quarantine. And so that's why we're asking you to test off campus as opposed to coming to campus if you're supposed to be in quarantine. Okay, thanks, Molly, for that clarification. My sincere apology, I've already addressed this. However, will students begin to move home tomorrow or Friday? We're going to encourage students to begin to move home tomorrow. Actually, if they don't have classes tomorrow or Friday, to move home later today if they can, just whenever their last class is. So that's what we're going to be encouraging. We have sent out a notice during this town hall to the community, and we're sending a notice to all parents and informing them of this decision. So I think that's it with the questions. Let me just conclude by, it would be remiss of me not to remind the community of the Days of Giving, which is next week, March 30th and 31st, Tuesday and Wednesday. Again, the theme is Anselmian influencers. We're asking people to celebrate those in our Anselmian community who have made an impact on your life. Over the past year, each member of the Hilltop have proven themselves to be an Anselmian influencer as we banded together through these challenging times. I know I could name every one of you as my Anselmian influencer, that's for sure. The Anselmian tradition of generosity and strength in numbers, wherever we are, carries on, and we really hope that we have great participation from our community on March 30th and 31st. Whenever we last traveled, it seems like 10 years ago, I was in Washington, D.C. at the Martin Luther King Jr. Memorial, and one of his quotes is inscribed on the wall, and it says, "The ultimate measure of a man is not where he stands in moment of comfort or convenience, but where he stands in times of challenge and controversy." And I would say, certainly expand that to say the ultimate measure of a community. We've certainly have seen challenge, we've seen controversy, we've seen all of those things, but we have stood hard and tall in these moments. And so it's worth reflecting on this sentiment as we push through this incredibly challenging time. I continue to be sustained genuinely by the faith of our community, our character, and the ways in which we have responded. So let's hang on for a little bit longer, support and encourage each other as we finish these last few miles of this grueling marathon. As we look behind us and see that boulder, we just keep running, and let's do our part to model good behavior and take it upon ourselves to help guide our students to do the same. We're almost there, but we're not at the finish line just yet. So since our next town hall is not until April the 7th, which is after Easter, let me just take a moment to wish you, and that comes from Patty and I both, wish you and your family a joyous and a peaceful Easter. I hope you have time with your family. I hope, given vaccinations, maybe you can see some extended family, and whatever else you do, make sure you get some rest, some downtime. So again, wishes to you. Be well, stay safe, and hope to see you around campus soon. See you later.